Hello, this is Doris Vick with MedAdvantage Resources. Thank you for joining us for the Anatomy of Hysterectomy CPT coding for surgical. I'd like to begin by asking one simple question. Do you know how to use the American Medical Association professional edition to code the surgical procedures anatomically? Consider this: surgeons specialize in performance of surgical procedures within an anatomical body system or organ. This same logic applies and is represented in the structure of the CPT coding manual. Surgical removal of the uterus is a hysterectomy, and it may involve other female genital organs during the same operative session. Let's begin by reviewing the following illustration of the anatomical parts such as the uterus and other female genital organs. Take a moment to review this. Note the organs are the fallopian tube, the ovaries, the uterus, the vagina, and then accessory organs belong to the urinary system, such as the urinary bladder, the urethra, the rectum, and the anus. These are often involved in procedures of the female anatomy. There is, on your screen, an anterior view, a frontal view, and also a lateral view from the side. Make a note of the organs involved. Now, using the table of contents in the CPT Professional Edition, locate all of these anatomical surgical procedures for the uterus. Review the code descriptions following the table of contents. Make note of the different surgical approaches, such as abdominal, vaginal, and laparoscopic. Abdominal code ranges go from 58150 to 58240. Again, review the exact code descriptions, noting the procedure codes that state with or without removal of the ovaries and fallopian tubes. Perhaps the procedure documentation includes suspension of the bladder or the vaginal area. Also, there are specific codes for malignancy. All of these you'll find underneath are indented for abdominal approach. Now take a look at the vaginal approach. Your code ranges for these are 58260 through 58294. Again, review the code descriptions, noting removal of the ovaries and fallopian tubes. You'll see the with or without for code selection. Also, procedures involving suspension of bladder or the vaginal area. In the vaginal approach for a hysterectomy, the weight of the uterus is extremely important in your appropriate code selection. Now let's look over at laparoscopic approach, 58541 through 58573. Note these on the table of contents. Also reference the code listing containing the exact description that you're looking for in the documentation for the operative report. Note the with and without removal of the ovaries and or fallopian tubes and your code assignment for those. Also, procedures involving suspension of bladder or vaginal area. The weight of the uterus is extremely important in selecting the appropriate code. Also, they are codes designated for malignant conditions. If you found this information to be valuable, check out our other topics on our blogs. If you're interested in trying a medical coding class, we'd like to invite you at this time to register for a free HCPCS coding course for Level 2. Our regular price for this is $100. We'd like to offer it to you with no cost. It includes the mentoring and direct contact with me, Doris Vick, your instructor. The link to our website is listed below on your screen. If you have any additional questions, you can still contact me for any clarification. The number is listed at the bottom of the screen. Thank you.